Welcome back to the introduction on cardiac surgery. This is part 2. It's called congenital anomalies. First, let's start with this slide. It is the classification of diseases in cardiac surgery. Generally, these commonly seen diseases are divided into two parts. That is congenital anomalies and acquired disorders. In this session, we are going to discuss the first part, that is congenital anomalies. Congenital anomalies are subdivided into two kinds. One is non-cyanotic, usually simple, and the other one is cyanotic. In non-cyanotic diseases, they are either abdominal communication, we call it defect, or stenosis in the cardiovascular system, because the pressure within the systematic system is higher than that in the pulmonary system. So if an abdominal communication exists, the left to right shunt is inevitable. These diseases including patent ductus arteriosus, that's called PDA, and atrial septal defect, ASD, ventricular septal defect, VSD. For stenosis, the commonly seen disease is the pulmonary stenosis. In cyanotic disease, which is much more complicated, usually the patient is usually cyanotic. The typical example is the tetralogy of Fallot. So let's start with the physiology of congenital disorders with left to right shunt. If you understand this chart thoroughly, it is easy for you to understand the clinical manifestations of these disorders. So let's start with the slide. If the left to right shunt is corrected, then the patient will have a normal life. If it is uncontrolled, the body is affected in two ways. The first one is that due to left to right shunt, the blood volume within pulmonary circulation is increased. And this time, patient may experience dyspnea and fatigue. And long time spasm and thickening of a pulmonary arterial wall will result in a pulmonary arterial hypertension. And now the right ventricle is overloaded. And then when the pressure within the pulmonary artery is greater than that in the systematic circulation, the left to right shunt is converted to right to left shunt. And this situation is called Eisenmenger syndrome. And now the patient began to have cyanosis. Usually, the patient will die from hemoptysis or congestive heart failure. The other side shows the increased burden on the heart due to the long time of a left to right shunt. And then the heart size will be increased. This will impair heart contractile function. So congestive heart failure is inevitable. And this time, patient may have dyspnea, edema of the peripheral limbs. And you should know that all these changes are closely correlated to the amount or the volume of the shunt. If the shunt is trivial, then the patient may remain asymptomatic. So now, let's discuss the specific disease. The first one is patent ductus arteriosus. It's called PDA. PDA is an opening between the upper descending aorta and the proximal portion of the left pulmonary artery, and it is the result of the persistent patent of the fetal ductus arteriosus. You should know, before birth, the fetal ductus is present in everybody, because it is an integrated part in fetal circulation. After birth, after the first cry, the lungs begin to work. This initiates the closure process of a PDA. So by age of 2 months, in 88% of a child, the ductus is closed completely. This shows the anatomy of the PDA. The upper one is the aorta. The lower one is the pulmonary artery. You see there is an opening between the two arteries. The size of PDA varies from a few milliliter to the size of a descending aorta. For treatment, the idea is very simple, to close it. Previously, the closure of a PDA was done by surgery. This photo was taken 15 years ago. At the time, surgery or surgical ligation was the only option for the disease. When it advanced in technology, now we have a new method to close the PDA. That is the occlusion with an occluder intervensively. Because there is no incision, the method is more popular than the surgical ligation. And now, let's study the atrial septal defect. It's called ASD. Definition. An ASD just is a hole of a variable size in the atrial septum. This drawing shows that there is a hole at the center of the heart. That's the septum, atrial septum. The left picture shows the intraoperative view of a ASD, and the drawing shows that how the ASD is being repaired with a patch. Just like that in treatment of a PDA, we have a new method for the treatment of ASD that's called occluder. But there is a limitation for this method. That means the rim of the ASD should be strong enough to hold the unpleasant. So that is to say, surgery is the last option for the treatment of the ASD. So this slide shows another disease called ventricular septal defect, because VSD. Definition is still simple. A ventricular septal defect is a hole of multiple holes in the intraventricular septum. The disease is more complicated than ASD because the types varies, and it is demanding to close the ASD than VSD technically.